I am going to introduce my buddy, my friend, my wonderful Dr. Henning Saupe from Germany, and he is going to be talking Saupe. Sorry, I have to give him the Italian way of saying it. Saupe. Saupe. He is going to be talking about cancer challenges today and a better way to treat cancer. So let's bring up Dr. Saupe. And Henning is also our medical director. He came on board to help us. We started building teams last year. We built a global partners who are up here in the front row and ambassadors who help us to get things done and to share their love and support with us, which is so needed. And so you're going to go.
So microphone works. There we go. A feedback loop to this one. Could you switch off this one, please? Okay. Yeah, thank you so much, dear John, for bringing me back to this conference. It's my fourth time at the Appleseed conference. It's a great honor and a pleasure seeing you all here and to inviting you to go on this journey with me about cancer, what is cancer, and how we work. A grip on cancer, after we understand cancer, and how can we turn that back when cancer knocks on our door. So my presentation today is called A Better Way to Treat Cancer and the Challenges today. A disclaimer, I do not practice medicine in the United States, just only for educational purposes and this does not replace medical treatment or medical advice. So, the current paradigm on cancer is the standard rotation theory. You look up cancer in a textbook, this is the first thing you learn, and all this theory points at is the cell. The standard paradigm investigates medicine says the cancer cell has a fixed genetic damage and must be eliminated. The cell is the problem. Unsolved challenges with this approach are metastasized systemic diseases seem to be not curable. Cancer cells get more and more resistant, and the way you treat them with blocking agents, with chemotherapy and radiation. And therapies are too toxic and eventually mutilating, and that is the problem at the end of the road of conventional classic Western world oncology programs. There's another paradigm that we know very well of, and let's call it the naturopathic paradigm. The vitality and the terrain is out of balance. So let's get the terrain back into balance to allow health to manifest. And that is the paradigm that was used or that was invented thousands of years ago. We can track that back to the time of Egyptian medicine. That's maybe the oldest medicine we can refer to. And then it was presented in a more modern way with more modern words and understandable language at the time of Hippocrates, the grandfather of modern medicine in Greece, 500 years before Christ, who said the most common reason for diseases is poor lifestyle. He invented hygiene as the art of healthy living. Hygiene, it was at that time much more than washing your hands. It was everything that had to do with a healthy lifestyle, and there was a goddess worship for being the goddess of health, Hygeia, and from that goddess we have the word hygiene. So Hippocrates was teaching his students and the world, listened to his teachings for more than 2,000 years, that the very basis of health is a balance of power, a balance of energies that we call humorous liquids in the ancient meaning of the word. And we all know these four archetypal energy types that he described and that he wanted to get back in balance. They're called water, air, fire, and earth. And in variations, we have the same concept in Chinese medicine, where we have 5 elements that need to be in balance in order to make health happen. So Chinese medicine splits up earth into wood and metal, 2 different aspects of the solid energy. And in Ayurvedic medicine, we have 3 principles, a variation of that. But altogether, the concept was health is a balance of power. And I bring you this picture from a medical textbook from the time of the 12th century in Germany. Hildegard von Bingen was a German nun, a Benedict nun, the founder of a monastery along the River Rhine at her time, and she was the most famous medical doctor of her time too. A couple of decades declared a saint by the Pope, and highly influenced her time and wrote textbooks. And this picture, if you can see it, represents man surrounded by God, by divine forces. So health in her interpretation was not only a balance of power, but was being integrated in God's holistic love or holistic energy that surrounds man. And you see herself, a portrait of her bottom left downside on this picture, and this red. I don't have a pointer here. This is an image of God Father, and he surrounds the human being, and it's a thread of energy that comes from the divine source of life. And to bring the patient back to a state of health means to care for a holistic flow of energy and bring man back to being embedded in divine forces. And much more is to say about that concept. So from looking at the cell to looking at the totality around the cell is quite a big step. Or the other way around, this was first. So to look from the totality of everything that matters in life to the cell is quite a step of reductionism. And that's what I want you to follow me with. So the naturopathic therapies affirm the terrain and look at the stagnation of the vitality as being the problem. And therapies incorporate diet, healthy lifestyle, detoxification, enhanced energy supply, and emotional and spiritual healing aspects. I don't see the pointer. Oh, yes, it's very weak. Yeah, okay, here, a little bit. Yeah, okay, thank you. Well, what are the unsolved challenges if we go the holistic, naturopathic, spiritual way? Well, advanced cancer is from a certain point in time and size on more and more disconnected from the terrain. I would love to help patients to heal from metastasized advanced cancer by only giving them the perfect diet or helping them with detoxification or helping them with deepening their spirituality. This all matters, but my point is that from a certain point on, if you want to change the physical reality of metastasized cancer, you need to do more than a pure naturopath would do. And I had to learn that the hard way. I'm in my 33rd year as a medical doctor, and if you had asked me 20 years ago, I would still have shared my vision with you that if you just do enough naturopathic therapies and detoxification and find the perfect diet, you could solve any problem. I can't tell you that is what I experienced the last years. So it's a very complex problem to solve, cancer from a certain stage on, and that is why we need to bring these two worlds together. I learned that the reality is a superposition of both concepts. I borrow the word superposition from physics, from quantum physics, that describe reality as an interesting mixture of interwoven aspects where both aspects are correct at the same time, and you need to make the best combination of the two strategies, the cell-focused and the terrain-focused. So my vision is to bring these two aspects together in a holistic view, the way quantum physics describes the nature of matter or the nature of light as being a superposition between matter and energy, both at the same time. We could deepen that thought for hours if we wanted to go that route, but I want you to take home the message that we need to work on both sides, on the holistic naturopathic energy side, but in advanced cancer we also need to take on board some strategies that give an immediate release for the patient who suffers from cancer, like surgery and sometimes radiation and sometimes chemotherapy. And what is left is to find out in what way we need to bring these two worlds together. What patients benefit the most from surgery, radiation, chemotherapy, and what patients do not benefit so much from these therapies that come with a lot of side effects. So, a few more slides on the history of medicine. I found that very, very interesting. I hope you follow me with this interest in the history of medicine to understand why your oncologist at your local hospital does not tell you anything about food and lifestyle and emotions and spirituality. And this is why it came to its end, this holistic era of medicine and medical philosophy, about 150 years ago, not so long time ago. And I found two pathologists that mark the transition from holistic to reductionistic, materialistic. And the first is the Vienna-based pathologist Karl von Rokitansky, who mentioned in his textbook on pathology for the last time the balance of power as the essence of health. And he refers to Hippocrates in his that was released as late as 1846 in Vienna. Only 9 years later, and here he still refers to the balance of power between earth and wind and fire and water as the essence of life. And a few years later, 9 years later to be accurate, the approach changed completely, mostly through the impact of a book that was published in Berlin by Rudolf Virchow, the professor and leading pathologist in Germany at his time. And his book, Cellular Pathology, ridiculed the energy system of Hippocrates and his colleague Rokitansky in Vienna and said there is only one thing that matters, and that's the cell. Forget everything else. Diseases derive from diseased cells, so let's get rid of the sick cell and the problem is solved. That is reductionism. Forget food, forget vitality, forget soul. He even ridiculed the existence of the soul and had an argument with the local pastor. And he was quite a famous figure. Can you imagine? At that time, there was still an emperor in Germany, and it was still quite a religious background, like everywhere on earth in the 19th century. And he dared to question the existence of the soul and had an argument with the local pastor and said, I've dissected thousands of bodies. I've never seen the soul. Literally. That was the kind of materialist he was. And very modern, and we owe him a lot of advantages that started with this reductionistic approach: surgery, anesthesia, radiology, the invention of the microscope to find the microbes that are involved in diseases. But he ended the era of holistic thinking and vitalism. Vitalism is the notion or the belief or the understanding that there is something vital within us. Vitality that is not described in physics. Physics is the science that describes how matter interacts with matter. And there is no understanding whatsoever in the medicine that I studied in the 80s and 90s in Germany. In my entire medical training, I never heard the word life forces, vitality, or even what is necessary to keep life ongoing, to protect life. Everything I learned, and I'm grateful for the 100,000 details I learned at my university, but everything I learned is about blocking the symptoms we don't want. What we do in naturopathic, holistic medicine is we support what we want. We support the flow of life. And follow me in my presentation what that is about in modern terms. So, 150 years ago, man, or the concept of man, the understanding of man changed from a spiritual being embedded in a material body to being a factory, like an industry palace. This picture is from the time of Rudolf Virchow, man as a machine. And that's the way we are perceived if we meet a reductionistic Western world doctor. He tries to fix us with something that blocks what we don't want. And don't get me wrong, I highly appreciate the skills of a surgeon if I fracture a leg and I need a screw in my bones to get a straight bone back, and or intensive care. I do not criticize it. I just try to describe the philosophy and the mindset behind it. So another example of the spiritual origin of man is this beautiful picture from the prayers book of the French king from 1415, called it's kept in a museum in northern Paris, and it describes man as embedded by 12 angelic beings here in the symbolized form of the zodiac signs. And in the corner of this picture, you still see or can read the energy concepts of Hippocrates and the balance of power between humid and dry, fire and cold, male and female, etc., qualities that need to be in balance. The anatomy of man, the very rich hours of the Duke of Berry, who later became the King of France in 1412. So this picture inspired me to translate the symbolism of the early time of Renaissance into modern concepts that we can understand. So in 1400, man was shown as being surrounded by 12 angelic beings, and every angelic being brings a certain quality to the human energy body. So in modern terms, we can translate that into something that we can understand and follow with modern science, and this is my interpretation of this 12-fold holistic circle around the human being. And I break it down into the concepts of control of inflammation, detoxification, nutritional abundance of fresh water, sufficient oxygen saturation, the proper gut flora, the balance of about 1,000 different microbial agents in my intestines, bacteria, fungi, and to a certain extent even viruses. Another health factor or contributing factor to the holistic understanding of health is an effective stress management. Very, very important in our time, that we find ways to get out of the stressful mindset that modern life pushes us to. So we need to work on the balance between stress and relaxation. There is a health factor called balance of blood sugar and adequate insulin response, everything that has to do with digestion and sugar. There is a health factor called the immune system, the wonderful and very, very complex immune system that we want to be smart. Not only strong, but smart. If it's too strong, we have allergies or autoimmune diseases. If it's too weak, we suffer from cold diseases like cancer and allow cells to grow in our body that should be controlled better by our immune system. So another important health factor. A health factor that is called the powerful mitochondrial function. I will guide you a little bit into the mitochondrial biology. That's where the energy is produced inside our cells. And that's where we can understand a very important characteristic of cancer if we study the nature of mitochondrial energy production. We will get there in a few minutes. A health factor that is about the balance between alkalinity and acidity. Two ways how our system can get out of balance. It can get too acidic or too much alkaline, and balance is the key. And to be in the right balance between acidity and alkalinity allows the healthy life to continue, and a tip to the acidic part gives either inflammatory diseases or a little later raise to cancerous diseases. Another factor is the control of infectious diseases. A lot of cancerous diseases are connected to infection or the consequence of an unsolved chronic infection like cervical cancer or gallbladder cancer or prostate cancer in a way. And so this is my interpretation of the holistic grid of energy systems around our body or within our body that we need to look at if we want to understand health. So the power of inflammation, detoxification, nutritional supply and abundance, water, oxygen, gut flora, stress management, sugar management, immune system, energy production, acidity and alkalinity and balance, and infection defense. If we turn these factors around, we can learn what causes cancer. Cancer is caused by too much inflammation, and very often on the level of silent inflammation. That's what you don't pay attention to. Your body is, the older we get, more and more affected by silent inflamed areas. Fatty tissue is silently inflamed. Our arteries get more and more inflammatory processes along the inner wall of the arteries. That's why arteries get more and more stiff and rigid and give rise to high blood pressure. Well, we could talk for hours about the different types of inflammation. I want you to learn that silent inflammation is a key factor for the development of cancerous tissues. And everything we can do to reduce inflammation can help us to reduce the risk of developing cancer or help us to make cancer more manageable. Toxicity. Very often, the consequence of a lack of detoxification properties. So I need to study how well my body detoxes, how well my kidney and my liver function gets rid of the metabolic waste products I produce every day, and if toxins accumulate, I get a higher risk to develop cancer. Nutritional deficiencies, of course, are linked to cancer. Wow, 10 minutes to go. Now I really need to speed up. No, I have an hour. I have an hour. And I started not an hour ago. Okay, thanks. Okay, so what I do now is I turn around the health factors into their opposite, and what I get is a map of risk factors for cancer. Chronic inflammation, overload of toxicity, nutritional deficiencies, and we don't have the time to go through all the details now, but I have the solution at the end of the presentation where we can get all the details. Water deficiency is a risk factor. If we drink too little, it's a risk factor to age too fast. And if we age too fast, we develop cancer with a higher risk than if we would drink enough water and dilute the toxins and help the body to detoxify. Oxygen deficiency is a risk factor for cancer, a very important one. Everything you can do to raise the level of oxygen in your tissues towards the healthy optimum helps you to suppress cancer. Or, from the other side, hypoxia, the lack of oxygen, promotes cancer growth. Unhealthy gut flora and leaky gut is very often something that contributes to more silent inflammation and gets our immune system out of balance so we don't find the cancer cells at an early stage and allow them to grow. Psychomental stress may be the most important factor in Western world countries that contribute to lack of health or to pre-early death. The World Health Organization has announced that already, to my knowledge, more than 20 years ago, that stress is the number one factor for too early death in developed countries. That's quite a statement. Blood sugar issues, high blood sugar, high insulin, a risk factor for cancer. All these factors together that you see around the center here cause an impact on our immune system that gets our immune system out of balance, that creates too much unwanted inflammation and too little cancer control. It's like a twofold impact, too much activity that goes into the inflammatory part and too little cancer control. Mitochondrial damage as a consequence of toxicity, inflammation, etc. Overacidity and chronic infections. This is my map, my risk factor map for cancer, and my book that I will show you a little later covers all these aspects in chapters that are that go through these factors and tell you what you can do to reverse it. So it's quite a complex map. Right? You tell me, or somebody tells me, well, breast cancer comes from cow's milk. Oh no, that's totally bad. Cow's milk may have a tiny little part in the drama, but for sure not to 100%. it's good to not drink cow's milk if you want to reduce inflammation and if you want to do something good for your microbiome. But it's not the case why somebody gets breast cancer. And please distinguish these two truths. Yeah, that something that is true might not be true if you make a complete rule out of it. So we have to look at cancer in a very, very thorough way that allows us to understand how factors interact. Otherwise, we miss the point and we slip out and believe that it's all about detoxification. It's all about amalgam in our teeth. Of course, amalgam in our teeth is not good, but to remove amalgam is not enough. Right. And one interesting thing about this risk factor map is that the factors interact with each other in a holistic way. That means the more dots you have on your map, risk factor map, the higher the risk in an interactive way. And how exactly is impossible to calculate out because it's interwoven. It's so complex that there is no clear mathematics. Forget straight one-to-one linear correlations. They don't exist. It's an illusion. So it's complex, and what can we do? We can work on these risk factors one by one and do your best. So we need to turn them around. The next step is that we have to learn that our psyche, our emotions, our beliefs interact with our body at any moment, as long as we live. There is no barrier between mental and physical. It's interwoven. It's one world. And that's, again, another very important message from holistic philosophy, that there are no clear boundaries between psyche and body. What you do for your body helps you to be more in balance in your psyche, and what you do for your psyche helps you to be more in balance for your body. And this discipline called psychoneuroimmunology is now fully accepted. The term was coined around the year 2000, and now you have institutes and world-leading universities around the world that do science in this field of psychoneuroimmunology, that study the interaction of our beliefs, emotions, feelings, and our immune system and our nervous system. And the answer we get from psychoneuroimmunology is it's a vivid interaction from both sides. It's one world, psyche and body is in constant exchange at any moment. So we need to turn this around. We work on inflammation and bring anti-inflammatory therapies to the board. We work on detoxification and help the patient to detoxify better. We bring all the nutrients back into the body so that there is an abundance of all the health-protecting nutrients, vitamin D, selenium, iodine, zinc, iron, to mention a few nutrients that are short in many people who develop cancer. We bring more water. We encourage the patient to drink more fresh filtered water to dilute the toxins and to make the biology happen in a vivid flow of chemistry. We bring more oxygen to the body by drugs, by special therapies like inhalation. Hydrogen inhalation is a very interesting new field that grows in our attention and that we use since a couple of years back in time very intensively at our clinic. It enables the body to absorb more oxygen. We work on the microbiome and the reintroduction of healthy bacteria and the balance of bacteria and the immune system in our guts. We work intensively on the mind-body connection and stress management strategies. Care for a low-carb diet that gives us the optimal blood sugar levels and the optimal excretion of insulin. We work on our immune system. We work on mitochondrial health with energy devices like pulse electromagnetic frequency devices or hydrogen inhalation again, or heat therapy, infrared, red light. We work on the balance between alkalinity and acidity, mostly with healthy diet. And we look if the patient is affected with chronic infections and try to erase the infection and reduce the inflammatory pressure from that side. So this is the holistic naturopathic approach Intersection. Sad chapter, but I need to mention it, and I know my colleague, one of our colleagues, will continue on that topic later on today. What I call opening the Pandora's box, COVID-19 and the so-called spikopathy. Spikopathy is a relatively new word to describe what happened after the interaction with the COVID virus or the infection or the vaccination, the production, the unnatural production of spike proteins that opened a totally new chapter of pathology that we did not have before. It adds factors to chronic inflammation, and it reduces the blood flow in the capillaries, and by doing that, it reduces the oxygen uptake in our tissues. We could easily talk for hours about this Pandora box that we opened a few years ago, and with the sad news that are now confirmed and not any longer called a conspiracy theory. We have to acknowledge that the virus came from a military laboratory, that it is or was a genetically modified virus, that we don't have a natural immunity against, and that caused problems that we never saw in real natural infections. And so we have more reasons to work on these health factors than ever before, because everything became more complicated since the COVID pandemic and the vaccination program started. Spike proteins, yeah, so from the infection or from COVID shots, so-called vaccination, I wouldn't call it vaccination, I would call gene therapy. So open questions about the spike proteins. How long do they endure in a human organism? What is their contribution to long COVID syndrome? What is actually a post-vax syndrome, and what is a long COVID syndrome? And the contribution to the increase of the cancer incidence that we all witness every day, although the official institutes hesitate to give us the numbers. And if you ask ChatGPT, you will get a very mellow answer about the correlation. But what I see, what my colleagues have seen the last years, is without any doubt a horrendous increase in cancer cases and more difficult cases with faster progression than what we saw before. So do we have any answers? For more information on that, please go to this website, imahealth.org. That's a lot of information about post-COVID and post-vax syndrome. So we were told that the vaccination helps us to flatten the curve and to protect our neighbors. That was not true. It was never true. And what we got is more inflammation and more microcirculation deficiencies or microcirculation issues. So my answers to this problem of blood clots and too much inflammation is some choices are more zinc, more quercetin, more protein-dissolving enzymes from nattokinase or serrapeptase or lumbrokinase, 3 names for enzymes that break down blood clots in a safe way, more vitamin C and magnesium, anti-inflammatory natural remedies, turmeric, frankincense, omega-3 fatty acids, aspirin, and more. Time does not allow me to go deeper into that, but I want to mention that I'm very much aware of the contribution of spikopathy to our main topic, which is cancer. So this is the orchestra of holistic treatments corresponding to these 12 health factors that you can read about in my book, or that you get if you come to 25 hours. You will take your clinic, and I will show you in a little while where it is and how it looks like. And now a few more details about the complex task we have when we deal with cancer. Remember the first slide, the standard paradigm, telling us that the problem is the cancer cell and we need to eliminate it with surgery, radiation, or chemotherapy. Well, if this patient comes in a very, very early stage, stage 1, no metastases, surgery has the power and the possibility to provide the patient with a cure. If you don't change the causes that cause cancer, you might get it back. But then it's a new disease. It's de novo from the beginning, one more time. But this disease that presented in stage 1 should be cured through a surgical intervention. But that is only the case in less than 50% of patients who come and see a doctor because of a lumbar symptom. So more than 50% of all cancer patients have a metastasized form of their disease from day 1 on when they were diagnosed. So in that stage, surgery cannot provide a cure any longer. It's a system disease already. So now we try to kill it with radiation or with chemotherapy, and that is where the problem starts, because I don't speak about leukemia and early childhood cancer and lymphomas. They're a little different. So let's make it a little more simple. If I say cancer, I'm aware of the fact that I speak about 500 different diseases in a gazillion different subtypes. Yeah? If you ask an expert in cancer genetics, you hear today or you learn that everybody has its own type of cancer. Peter has Peter's cancer and Mary has Mary's cancer. So what I tell you now is most of all the case in carcinomas, solid cancer, cancer that comes from digestive tract organs or glands. So let's leave the leukemias and the lymphomas out for a little while. In carcinomas, we know that not all cells at a certain point in time are receptive for chemotherapy or radiation. They are in a dormant or resting state. And no matter how many times you expose the body to a toxic mixture of chemotherapy, statistically, you will never be able to kill 100% of the cancer cells. Never. It can be proven with statistics and pharmacology. Because there will always, at every point in time, be a subfraction of cancer cells that are, at this point in time, not sensitive to the treatment. So all we can do with chemotherapy and radiation is to downsize the number of cancer cells down to a level where we believe that the body does the rest. The body is, from this little amount of remaining cancer cells, able to control the process, and that's what we call health. You got me? So chemotherapy can only reduce in a logarithmic curve. That means in the beginning more, and the more often you use it, less and less and less, lowers the amount of existing cancer cells in your body. Because they're not only active cancer cells, there are cancer cells that we call quiescent cells, resting cells. There are cancer cells that are in dormancy, sleeping cancer cells. And there are aged cells, cancer cells in senescence. And you see the percentage between 1 and a few percent are dormant, quiescent, or senescent, and they do not respond to chemotherapy the way we want it. So we always get a reduction of the 80% active cells, but we miss the quiescent, senescent, and dormant cells. And they become the next tumor progression. So the way out, is there a way out? Because classic chemotherapy in advanced cancer guides us into a one-way road. It becomes more and more toxic, and there will be more and more cancer cells that are not receptive and survive the procedure. And the way out for me, or the potential cure of cancer in the metastasized stage, is what I try to bring into this picture here, that we, at some point in time, try to make friends with the cancer cell. What does that mean? A healthy organism consists of cooperating cells, and cancer redifferentiation is the second aim, parallel to the approach of classic oncology that tries to kill them all. If we have to acknowledge that that is impossible in metastasized cancer, then we have to go the secondary way, parallel to it, and find out how much do we need to invest in this and how much do we need to invest in that approach. So cancer redifferentiation is very much about repairing the mitochondria. If I had another hour, I could explain in great detail the difference between the mitochondria in cancer cells and the mitochondria in healthy cells. It's a big difference. Let me summarize it with the following words. A cancer cell has a mitochondrial damage that reduces the production of usable energy in cancer mitochondria down to 1/18 of what is necessary to live a healthy life. With that little energy, the cancer cell can only behave as a cancer cell, shutting off its communication with surrounding cells and just try to survive as an autist, as a little cell that does not care for the rest of your body. It's a cell in an emergency survival mode because of lack of energy. So everything we can do to repair the sad mitochondrium of a cancer cell helps us to make cancer less aggressive. And that is maybe the essence of naturopathic treatments. Look through the keyhole of a mitochondrial biologist. We want to repair the mitochondria. To give you an idea, not everybody here is a biologist or has a medical background. What are mitochondria? A few words. Tiny, tiny little units inside our cells that produce energy from what we eat and what we inhale in the form of oxygen. At any moment in our life, literally trillions of mitochondria in our body produce the energy we live on. Somebody calculated out how much the mass would be if we would extract all the mitochondria from our body. It's a mass at the size of our brain, approximately 2 kilograms. What's that? 4 pounds. That's how many mitochondria I have in my body. And somebody calculated out how much ATP they produce a day, and that's your body weight. So my body produced today 85 kilograms. What's that? 170 pounds of ATP today. And I burned it down, and I produce it, and I burn it down. So it's an enormous metabolic production of, metabolic activity and production of an energy carrier molecule, and that is what is short in cancer cells. Cancer cells are extremely short in energy. That's why they behave so pathologically. Do not listen to the signals and grow out of control. So, if we would be able to repair the mitochondrial damage, we would be able to cure cancer. Go that route as much as we can. And let's use the knowledge about mitochondrial repair in cancer treatment. And unfortunately, that is still not on the table in traditional Western world evidence-based medical protocols, but it's well known to the medical science or to the biological science around cancer. Give you an example, there is an institute at Boston University run by Professor Thomas Seyfried, the publisher of a book called Cancer as a Metabolic Disease. There's another book published, Cancer as a Mitochondrial Disease, so there's a lot of scientific evidence for this theory that cancer is a mitochondrial disease, and if we would be able to repair the damage, we would be able to cure cancer. That's the opposite of killing cancer. That's redifferentiation of cancer cells and make healthy cells out of cancer cells and repair them. And unfortunately, the two approaches, the toxic approach and the metabolic approach, have some conflicts because every toxic therapy does more damage to the mitochondria. So the cells that you don't kill with chemotherapy become more resistant because they are even more heavily damaged in their mitochondrial function. I show you my my answer for a way out of this dilemma. How can we support the mitochondria without doing and how can we reduce cancer with gentle treatments that do not so much harm to our health? So this is what I want to do with the mitochondria. I want them to go back and shine and produce the energy they are supposed to produce. And Thomas Seyfried's book, Cancer as a Metabolic Disease, describes that way. It's quite complicated, this book, not a book you want to read because it's full of biochemistry, but it shows that it is possible in laboratories, in tissue samples, and to a certain extent in human bodies. So that's the project we have to continue on and to find out how can we transform that knowledge from cellular to clinical treatments. But it's a way. That's the prophecy of the cure of cancer, if you ask me. The prophecy of the cure of cancer with chemotherapy is not realistic. So a healthy organism, if you repair the mitochondria, cancer cells cooperate again with other cells and stop growing out of control. So then we get a coherent, cooperative system of cells again once we have started to work on their mitochondria. So a healthy interaction of cells that have enough energy to care for the neighboring cell, that's the aim. Next slide is about smart anti-cancer therapies that offer a more gentle approach to reduce the amount of existing tumorous masses, something that is very, very necessary if I see a patient, and the average patient I see is in a stage 3 or 4 with uncontrolled progression, despite all the therapies she or he got before she met me. And that represents a challenge because we need to stop the cancer growth quite fast because we don't have time to wait for a proper detoxification and a repair of the gut flora that takes 2, 3, 4, 5, 6 months. Yes? So we need to stop cancer as fast as possible to have more time to work on the healthy part and the mitochondrial repair. So what can we do? And what we use to work on cancer reduction at our clinic and at other clinics in Germany is we use hyperthermia, which is treatment with heat, with radio waves or infrared light, and we use chemotherapy in a modified way that takes advantage of the fact that cancer cells are dependent on sugar. And if we reduce blood sugar and give a reduced dosage of chemotherapy under low blood sugar circumstances, we can hit the cancer cell quite heavily and reduce the activity and progression of cancer without exposing the body to the full toxic dose of chemotherapy. We talk about 20% chemotherapy that we use under insulin modification, blood sugar modification with insulin, compared to 100%. That's a big difference in toxicity. And because of the fact that the cancer cell is much more vulnerable or receptive to chemotherapy when there is no sugar around, because it opens its cell membranes, it opens its gaps for both sugar and drugs, we can hit the cancer cell many times more effectively under low blood sugar circumstances, something that is called insulin-potentiated low-dose chemotherapy. So these are the two pillars that we build our cancer reduction program on. Hyperthermia as a treatment enhancer. We warm up the cancerous tissues gently with infrared or radio wave heat, something that is harmless for the rest of the body. And we use low-dose chemotherapy under insulin potentiation under low blood sugar circumstances. And this is my teacher in insulin potentiated low-dose chemotherapy. It's the grandson of the inventor, Dr. Garcia Perez III. His father and then his grandfather was the inventor of insulin potentiation chemotherapy in Mexico in the 1940s and 50s. So Dr. Garcia Perez III is still active. His picture is now 5 or 6 years old. He's now in his mid-70s and still going strong and leading a clinic in Tijuana that is famous for insulin potentiation therapy. And he has an academy where one can get a certificate and a training for insulin potentiated low-dose chemotherapy. You need to know how to do it. Of course, it's a technique that you can learn and how to use insulin in the right dosage and where the optimal blood sugar level is to add the chemotherapy on. There is one book published about it for the colleagues here who want to learn more about the details here, treating cancer with insulin potentiation. A summary of the procedure: we use insulin injected intravenously. We monitor blood sugar very, very carefully every 10th minute, and at the right moment, we give the infusion of 20% chemotherapy based on an individual chemosensitivity test. So every patient gets tested individually based on a chemosensitivity test that a laboratory in our vicinity in Düsseldorf does based on circulating tumor cells. So that's another very important step. One size fits all is not good enough. What's in the guidelines is not good enough. It can be good for Mary, but not good for Petra, because Petra has a different genetic background and does not respond to the first line recommendation, and based on her individual test, she responds better to other drugs. So that's why we do an individualized sensitivity test for every patient based on circulatory tumor cells. Then we choose the drugs, and then we administer them in 20% dosage under low blood sugar circumstances, twice a week, 3 or 4 weeks in a row. This is a local hyperthermia device that works with radio frequency. We put the applicators around the tumor, typically, for instance, liver metastases or lung metastases, and for 1 hour, we expose the tumor to harmless radio waves that heat up the tumor up to a temperature of around 110 Fahrenheit, which is pretty hot. But it's a selective overheating of tumor cells based on the physics of this machine and a lot of science behind it. So the healthy tissues around the tumor do not get overheated, but because of a physical law between cancer cells and radio frequencies, they pick up more of the energy that is emitted in this frequency bandwidth of 13.56 megahertz, and that gives us a selective overheating of cancer cells without doing harm to the cells around it. And that, together with the drug, gives a good synergy effect. Whole body hyperthermia is used as another stimulant for general detoxification, blood flow, oxygenation, and we give parallel infusions. That's a procedure our patients get once a week, sometimes twice a week, depends on age and general aspects of the patient's vitality. You see the patient is on a hammock. There is a flow of 6,000 watt infrared radiators from underneath, and there is a foil around the patient that keeps the warmth, like a cocoon around the patient, and the nurse is with the patient throughout the entire procedure, and the doctor comes in and out and checks the vital function. Procedure takes around 3 hours and is the most intensive therapy that we offer once a week. That's the treatment for that day. After such a treatment, the patient needs to rest for 2-3 hours and is a little bit exhausted. But already the day after, patients say, I feel great, I feel less tired, I feel more clear in my head. So general detoxification, oxygenation, and parallel to infusion, something we use since I started the Arcadia Clinic 15 years ago. Yeah, now I want you to follow me through some guidelines for somebody who is just diagnosed with cancer. What you need to do if cancer knocks at your door. You need to understand what happened. This is your recovery plan. Understand. Once you get out of the first shock, try to understand what happened. Get a clear diagnosis. This often, if not always, requires a biopsy. Long discussion, is a biopsy dangerous, is it necessary? With the little time I have, I say it's necessary. We need to have clarity. What type of tissue is it? Because we cannot treat a patient if we don't know what type of cancer it is. So please accept the fact that a biopsy is necessary for your doctor to treat you appropriately. Find your body's weaknesses through a comprehensive examination and lots of sophisticated biological tests and analysis. That's where you need a holistic doctor or naturopathic doctor to do the microbiome test, the toxicity test, the immune system test. That is what Dr. Nesha Winters would have told you in her lecture. Assess and don't guess. Get as much information as possible. Prepare for surgery with a neoadjuvant treatment. That means prior surgery. Booster your immune system, recharge your batteries maximally, and try to reduce cancer already a little bit, as much as you can, with a good strategy that a doctor helps you to find, in order to shrink the tumor before you go to surgery. Then do the surgery, then do an adjuvant treatment to make everything possible to not get a relapse. Reduce the risk of a recurrence. And instead of systemic diseases, you need to act systemically from the beginning. Lymphomas, leukemias, multiple myeloma need to be treated systemically from the first moment on. Now, on the mental side, accept your diagnosis, but not your prognosis. Prognosis is something for statisticians, for politicians that run big hospitals and want to know how much beds do I need for this state. But for you as an individual, prognosis can be completely wrong and quite burdening mentally, emotionally. So accept the diagnosis, but if somebody shows you a prognosis, raise your eyebrow and say, oh, well, that's an interesting number. Let's try to beat it. You are unique, and nobody exactly knows what you're able to do and to accomplish. Doctors are no soothsayers. And don't try to make your doctor a soothsayer. I get the question so many times, doctor, how many months or years do I have? And I resist to give my patients an answer. I say, I don't know. You want me to show you the number from statistics? I don't know what you're able to. Let's aim at a long and happy life. And that makes a big difference mentally. Medical statistics are for science. I already mentioned that. Create a team of specialists around you. Accept the fact that oncologists are specialists for drug-based therapies and by definition not interested in holistic therapies. I've never met an exception. Don't waste your time by getting mad at the system. Find your allies. Use every specialist for special aspects of your treatment. If you meet a radiologist, accept that she's a radiologist. That's what she's good at. Don't try to ask her about diet. It's not worth the time. Find your allies. Find a life coach. Always remember, you are the boss. You are the boss. And I'm your partner in this journey to find ways to better health. I've met so many patients who are afraid of their doctors when they tell them I changed my diet or I pray or I do this, and they're knocked down by the negative attitude of doctors. Don't do that. Therapist in Greek means servant. So a therapist is a servant. Do only what feels right. If it doesn't feel right, get more information until it feels right. 1 minute left. For every therapy, there's a risk-benefit ratio. That means find out your individual risk-benefit ratio. If you try to cure cancer with chamomile tea, there's no risk, but the benefit will be very, very low. If you try to get only heavy chemotherapy, there will be a benefit short time, but the risk of side effects will be very high. So you need to find your sweet spot between risks and benefits. And that is my job from morning to evening, to help my individual patients to find out their sweet spot between risks and benefits. Find your inner conflicts. Now we go to the emotional part again. Write them down. Acknowledge what is. Get a coach on board. Work with mindfulness. I have to speed up a little bit. It starts like this. Cancer knocks at the door. The room is flooded. Everything is a chaos. Wake up. Clean it up with strategies that help you to get out of the dangerous misery fast. You need, in many, many cases, you need a surgeon. Sometimes you need radiation. Sometimes you need chemotherapy. But if you only do that, you will suffer from the fumes of chemotherapy, expressed here in this funny picture, as a secondary problem. Toxicity and the side effects of therapies can become the number one problem after a while. So don't let it go to that extent that the therapies, the cleaning device here, spoils the atmosphere with toxicity. Find the many, many reasons that cause the misery. Work on your gut flora, work on your inner issues, work on nutritional deficiencies, and restore the room. Refurnish the house. Implement the holistic vitality program in your life after surgery. Again, the circle of therapies, everything we do at our clinic, that is based on what I have said last hour. And before we close, I do not want to miss this insight to share with you. Healing happens between therapies. Healing is to me a sacred place. It's not what a medical doctor can give you in a package. Healing happens within you and is a sacred spiritual process. It rhymes with wholeness and holistic and holy. This belongs together. And I want to close my lecture with a very famous quotation from 1,500 years ago. Benedict of Nursia, the founder of the Benedict order, once said, "Pray and work, ora et labora." Both. And you get together the physical aspect and the holistic aspects. It's one. Our life is a superposition of prayers and work. And that's how it should be. And there is no contradiction. The opposite. It works together very, very well. Do your work and pray at the same time. And then the second part of the quotation that is not so famous will become true. Then Deus adest sine mora. God will help without delay. Pray and work at the same time. Rely on both, and that means that you from time to time need to let go. the prayer aspect for me is to let go and to understand that I cannot push too much. I cannot buy health or healing. There is something bigger than what I can bring to the table. I can bring a lot to the table, but then I need to be open for what happens, and that is what we call grace. And last not least, thank you. Last not least, if you want to read a beautiful healing story and what is possible, you can read Carola's story on my Facebook site. There is the link to my Facebook site. Carola has now been in complete remission, no evidence of disease, for 5 years in a row. She came to our clinic 5 years ago, and the situation really did not look very uplifting. She had her third reoccurrence from stage 4 metastasized ovarian cancer, heavily pre-treated with chemotherapy and surgery, and after 2 cycles of low-dose chemotherapy, hypothermia, holistic program, her cancer marker went down to normal, and she has been examined ever since, now 5 years in a row. No reoccurrence, no evidence of disease 5 years in a row. I'm very proud of that story. That was published in a Swedish lifestyle magazine. She lives in Sweden, and I'm allowed to tell her story because she did it in public in this lifestyle magazine. So you can read her story. I translated the Swedish article into English on my Facebook site. This is where you can read more about what I was not able to tell you in this hour, the German version of the book, Krebs and German Cancer, and the English version that I share with you on my book table, Holistic Cancer Medicine, that was published in 22. And if you want to know where I work, this is a picture of Arcadia Clinic, a clinic located in the center of Germany. We have 3 medical doctors. The staff altogether is 25 people who work at Arcadia Clinic. We pick up our guests from Frankfurt Airport and bring them door to door, take care of them in our patient hotel, and do all the things that I told you here that are part of our treatment program. Average stay is 3 weeks, sometimes 4, and we do follow-ups for as long as our patient needed. And this is Jenny, one of our secretaries. I would love to answer your questions if you send us an email or call us. Thank you very much.
Thank you, Henning. Dr. Saupe, do you have time for a couple of questions?
Yes, of course.
We're going to take one from that side. John's on that mic, and if anybody on this side has a question, if you want to come on up. Anybody have a question here? Okay.
Question over here.
Jenny Bradley.
Hello, thanks for being here again in your leadership, Dr. Saupe. I'm back here over here. Inflammation is one of your major factors. Can you talk about briefly for us, knowing that every case is individual, can you give us some general guidelines after a surgery or procedure, kind of what you're aiming at in possible therapy ideas? Like, what are you doing to help inflammation after surgeries?
Inflammation?
Yes.
Okay. I care for better blood flow with massage, pulsed electromagnetic frequency therapies, encourage the patients to be more physically active. We use vibration plates to stimulate circulation. We work with anti-inflammatory food supplements and naturopathic remedies like turmeric, bromelain from pineapple, papaya extract, omega-3 fatty acids, quercetin, anti-inflammatory diet, which is modified Mediterranean diet, minus pork, minus polysaturated fatty acids, minus obviously pro-inflammatory food components. You can read the details in my book. We use, in a more intensive approach, we use turmeric extract intravenously. We have a compound pharmacy that produces injectable curcumin from turmeric. We sometimes use anti-inflammatory repurposed drugs like celecoxib, aspirin, and other anti-inflammatory pharmaceuticals. And we offer mindfulness training to reduce stress, which is directly anti-inflammatory via the psychoneurological pathway.
Okay,
Hello, doctor. I just want to say that was great, and I agree with you on the integrative of both sides of medicine being an ex-nurse. And in my practice, it's been successful because of that theory. But my two-part question is, number one, how do you feel about extreme enzyme for shrinking tumors?
Yep.
And how do you feel? Here's my other thing. Nobody likes to do advanced cancers anywhere in the world. They're hard. Like you said, you had one story. Like, where's the hundreds of stories, right? So my thing is, why would you use oxygen in an advanced cancer when it's already got its own blood supply? So are we growing that late stage cancer by, instead of not giving them oxygen, should we be cutting it off at this point?
There were many questions. So, what was the first? The oxygen.
Take one of those questions because we have a long list here, and we only have 4 minutes for questions.
Don't worry about
the oxygen.
The oxygen. Well,
Sorry.
does oxygen stimulate cancer growth? No. Does hypoxia, the lack of oxygen, stimulate cancer growth? Yes. Of course, everything is toxic. The dose makes something a toxin. Paracelsus, 500 years ago. Everything can be toxic. The dose makes something a toxin. So, if you bombard the body with oxygen for too long periods, you produce too many oxidative stress free radicals. But if you know what you can do with oxygen, oxygenation is good in cancer therapy. Some doctors are specialized in HBOT, hyperbaric oxygen therapy, which we don't have at our clinic, but it's beneficial, and there are studies around that. We give oxygen inhalation parallel to hypothermia, and we promote and give hydrogen inhalation, which indirectly brings more oxygen into the tissue. So I have good experiences with that, and I've never seen that pushes the cancer growth. The opposite.
Okay, we only have 4.5 minutes left for questions, so we're going to take it over to the other side.
And enzyme therapy I support, maybe not on the level of Dr. Gonzalez, which is an extreme example for high dosage. Enzyme therapy, I have no experience with that, but enzymes belong to the program that we give. We give almost every patient digestive enzymes.
So the next question is on that side.
Hi there. Thank you for the very informative chart of the 12 steps to create healthy cells. That was wonderful. You talked about detoxification and of your body and how to detox. I've heard of a lot of people promoting fasting, and I wanted to know what your take on fasting was, if it does help, and if specific cancers react better to certain types of fasting.
With the patients I see in stage 3 and 4, I'm very careful with fasting because they have a weight issue. They have lost weight. I almost never see obese patients. That has several factors, because the kind of patients I see are highly motivated, and they come a long way to see us, and they pay a lot of money to get the treatment. So I believe they are already very knowledgeable in terms of avoiding bad food. So they have no overweight issues. So in a normal weight or even in an underweight cancer patient, I'm very careful with fasting. I do not recommend it. I recommend maybe fasting mimicking diet, 18 hours fasting, 6 hours food intake, or I always recommend low carb and gluten-free, dairy-free, fresh food, a lot of raw food, but also cooked food, a mixture of all the healthy aspects. But I do not openly recommend fasting in the type of patients I see.
Thank you. So we have time for 2 more quick questions, and then for those of you that are in line, I'm sure Dr. Saupe wouldn't mind talking with you out in the hallway if you want to, or some other time during the conference, because he's going to be around. So we have one quick
I'm here until Saturday evening, and I have a book table in the ale here, and you can grab me on the ale and ask me a question.
Hi, thank you very much for everything, Dr. Saupe. I'm Kirsten Spencer from Mess Up UK, which is a metastatic breast cancer charity. And one of the questions I was interested in is, in the time when you're using thermal therapy, a lot of breast cancer patients actually have bone-only metastasis, and you only talk to soft tissue. Would it work in the bones as well as the soft? Because would it actually permeate through into the bones as well as the soft tissue?
It does, a little more slowly. Bone metastases are more rigid, and everything is slower, both the progression and the remission too. So yes, with some patience, and if you do it long enough, you can expect that you get a result even in bone mets.
We have one over on that side.
Thank you very much for your presentation. My question is, are there any, when there's metastases to the brain, are there any special considerations or special or treatments that you might include or not do in those cases? Like with hypothermia, would you, keep the person's...
It's a very wide question. This is what I do from morning to evening to find out what is best for this individual patient and what is best for that individual patient. So, for instance, brain metastases and whole body hyperthermia can be risky because fever can trigger epileptic activity in the brain that is already on the edge of epileptic activity from brain mets. So that means you have to treat the patient with anti-epileptic drugs and steroids to reduce the pressure and the skull pressure. And now we could go through all the different subtypes. Sorry, the question is very wide.
Maybe you could talk about that over lunch.
Thank you very much.
And the more specific your question is, the easier it is.
We have one more question on this side.
Hi, doctor. That was great. My name is Vera. I'm a 4-time cancer survivor. Most recently, brain cancer. I'm sorry. And I work with Dr. Ellen Langer at Harvard in the mindfulness lab.
Yeah.
So do you know about her?
I know her, yeah.
And I've been spending all week with my naturopath, thank you God, and I'm so grateful. She's all about dental, the dental. She said before you do chemosensitivity, before you do anything, the dental, you got to go see a biological dentist. So please talk about that real quickly.
Yeah, okay. Absolutely interesting, important, and sometimes just very difficult to get it done. I have a colleague in Switzerland who says the same. He says, if you don't go to my biological dentist colleague before you meet me, I don't want to see you. But that comes sometimes with an investment of $30,000, $40,000, $50,000, $60,000, and not everybody has that in his pockets before you even start a complementary cancer treatment. So if money is not an issue, do everything to get your root canal fillings replaced and fix your dental problems with a biological dentist. Do the most obvious things first. The amalgam removal doesn't cost $50,000, but if you want to have 24 new teeth with root canal filling replaced, then it's a lot of money. So in theory, I support it fully. In practice, I have to find out what the patient is able to do. And if the patient has the time to go through biological dentistry, because that takes sometimes months to get the things replaced. And if cancer is growing and symptoms are getting worse and pain is a problem, I don't have the 3 months to wait until the patient is done after carefully biological dentistry. So again, individual discussion, what is really, really necessary if the patient has black corroded amalgam fillings next to gold crowns. Ooh, this is a bomb. Yeah, it's a battery in the mouth, and it disrupts the flow of many, many biological pathways. So then please go and see a dentist to at least remove the black corroded amalgam fillings. That takes a day. Yeah, so that's not doable. But some programs take months to do, like root canal removal and implants. So in general, I'm wide open for collaboration. And actually, we have a biological dentist in our village, and we cooperate. But I cannot say that every patient that I see has to go through biological dentistry before we can start to work. Okay, thanks.